Okay, now we have the testosterone gel. This is the commercially available testosterone gel made for men. This is 1% gel. It contains 50 milligrams of testosterone per 5-gram tube. This contains 30 tubes. You are using a 1/10 of this tube for most women. You might need a little bit more than that, but a 1/10 of this tube, because there's 50 milligrams in this one tube, a tenth of that is 5 milligrams. That is a typical starting dose. Occasionally women need less, and sometimes women need more, but a vast majority of women will achieve both their symptomatic goals in combination with their ideal levels of testosterone with 5 milligrams. You can take this tube and you can eyeball it. So you're looking for something like a pea-sized amount. So it doesn't stand up as perfectly as you would imagine. So it's not going to be exact. And that's what I was talking about when I did the section on the cream, that some women prefer to have more precise dosing. I don't think it's a really big deal, because as long as you're getting in the general ballpark, maybe you're going up by like 1 milligram, down by 1 milligram, it's not going to be a huge difference. You can apply it to your inner upper arms, your lower abdomen, pelvic area, your bottom, your thighs, the back of your knee. Same place you can apply the cream, and again, you're rotating it around. Another way I found to get a little bit more precise dosing, you can get a box of these off of Amazon. It's like $5 for 12 of them. You really only need one. You can get just one, but you know, it's hard to get just one of anything these days. So this is a 5 ml syringe, has no needle at the top. So there are 5 mLs. I have inserted an entire tube of gel into this applicator. So I'm just going to squeeze it up to the top so you can see. If you're trying to do a 1/10 of this, you've got these little graduated lines. So if you see, I know it's very difficult to see, but it has these little lines. So 1, 2, 3, 4, 5. So there's 1 ml. 1, 2, 3, 4, 5. There's 2 mLs. 1, 2, 3, 4, 5. There's 3 mLs. So if 1 ml is going to have 10 milligrams, then you're going to do a 1/2 of an ml. So that is 3 lines. So it would look like, so about the same as I just showed you. So that is 3 lines, about a pea-sized amount. There's the tube for reference. I know it's not perfect, but you get the idea. So if you want a little bit more precise dosing, super easy to just get one of these 5 ml syringes with no needle and insert your testosterone in here. And you know what, you guys? If you get this testosterone off of GoodRx, just go to the GoodRx website and punch in testosterone, this particular gel, and it will list the pharmacies near you that accept GoodRx coupons and what the price will be. And you can see a huge variety of prices, but in general, you can usually find it for around $100 for 30 tubes. If you're using a 1/10 of this tube and you have 30 of them, that's gonna last you 300 days. So this is gonna be basically a year supply for $100. The cream, remember, a little bit more precise dosing. Some people prefer it for that reason. You're looking at around $100 for a 3-month supply. For the gel, you're looking at about $100 for a 1-year supply if you get it with a GoodRx coupon. If you don't have a GoodRx coupon, then you are looking at probably around $500 or $600. So if you go to your pharmacy and they tell you it's gonna be $600, don't buy it. You do not have to spend that much on this testosterone. You can find a cheaper way to get it. You just might have to switch the pharmacy that you're using. For example, I had a woman recently, GoodRx showed that her pharmacy she was using is kind of like a smaller pharmacy. It wasn't one of these big commercial pharmacies. Said that they accepted a GoodRx coupon, but when I prescribed it to her, they said, you know, it's going to cost $600. And she was like, what the heck? I talked to them. They said, well, we take GoodRx coupons, but not for controlled substances, which testosterone is because of all the doping and weird stuff that men did back in the 80s and the 90s. We're using trace amounts. It shouldn't be that way for us at these dosages. We have no risk associated with these dosages, but it is still considered a controlled substance, so they have lots of rules around it. So anyhow, this particular pharmacy, they don't use GoodRx coupons for controlled substances, so we just had to find a different pharmacy. We found a more commercial pharmacy that is a little bit larger. It was $92 for her, you know, for her 300-day supply. So you might have to finagle it a little bit, look around, but GoodRx coupon is awesome. And there's a lot of different options for this testosterone gel. It comes in different concentrations. This is just the one that is the easiest to figure out. So anyhow, just replicate it this way if you want to use the commercially available testosterone. Your insurance will never pay for it. What I see 9 times out of 10, when I create the prescription, I write a little note to the pharmacist. Insurance will not cover, patient will pay out of pocket with GoodRx coupon. They almost never see that little note. And so they will bounce it back to me saying, prior authorization required. But remember, there's no FDA approved commercial product for women. So insurance are not required to pay for testosterone. If they're not required to pay for something, you know they are not going to pay for it. So if your pharmacy says to you, we're waiting for information from your doctor, most likely what they're waiting for is a prior authorization, which is what they're saying, you know, get authorization from their insurance to pay for it. We already know that's not going to happen. So you can just skip all of those steps and say, I'm paying out of pocket for this. What is the cost out of pocket? You can ignore insurance altogether and they will go, okay, then they'll give it to you and it'll be much easier. Don't mess around with prior authorization. So just pay out of pocket, get your testosterone, use whatever your preferred option is.